You're sitting in the third row of your granddaughter's school play. She's about to deliver her one line. The whole gymnasium goes quiet. And right then, right at that exact moment, your throat fills up. That thick, stubborn mucus that seems to live at the back of your throat now. You swallow once, twice. You try to stay still. You can't. You clear your throat, loud enough that the grandmother sitting beside you gives you a look. That was 10 in the morning. By lunch, it happened again on the phone with your insurance company. By 3 o'clock during the drive home, and again after dinner. You've probably assumed you know why this keeps happening. Maybe allergies, maybe something you're eating, maybe just getting older. You don't. What's actually driving this is something most people have never been told, and it starts somewhere most people would never think to look. My name is Dr. Chima Okoye. I'm a board-certified ear, nose, and throat specialist. What makes an ENT different from a regular physician is that I actually scope the anatomy. I see firsthand where mucus is produced, the paths it travels, and exactly where it stalls. A general practitioner simply cannot do that in a standard appointment. By the end of this video, you'll understand the true origin of what you're experiencing, why past fixes haven't worked, and what genuinely does. Rachel is a 64-year-old retired music teacher from Savannah, Georgia. She came to my clinic after 2.5 years of constant throat clearing. She'd tried 3 different antihistamines, 2 rounds of nasal spray, an elimination diet that cut out dairy entirely for 4 months, and a humidifier running in every room of her house. She'd stopped attending her book club because the clearing was disruptive and embarrassing. She'd started declining phone calls with her sister because talking seemed to make it worse within minutes. Her mornings were entirely consumed by it. She told me she felt like her own body had turned against her and that she didn't recognize herself anymore. She was exhausted from compensating for it, explaining herself, and quietly apologizing in social situations. When she finally sat down in my office, she said simply, "I just want to know what's wrong with me." What we found wasn't what she expected. Here's what's actually happening inside your body, and I want you to pay close attention because this changes everything. Lining your nasal passages and throat are millions of microscopic hair-like structures called cilia. Their entire job is motion. They beat in coordinated waves to sweep mucus up and out, quietly, constantly, without you ever noticing. This process is called mucociliary clearance, and when it works correctly, you never feel it. Mucus gets made, cilia sweep it away, done. But after 55, the beat frequency of those cilia slows down. They don't wave in rhythm anymore. Some sections fall out of sync entirely. Think of it like a stadium crowd doing the wave. When everyone moves in sequence, it rolls smoothly across the whole arena. But when sections miss their cue, the wave breaks and everything stalls. That's what's happening in your throat. The mucus isn't being overproduced, it's not being cleared. It pools at the back of your throat, which is a collection point, not a production site, and it thickens as it sits. The mistake most people make is assuming the throat is the source. So they gargle, they spray, they try lozenges. All of that targets the wrong location. The warning signal to watch for is texture. If the mucus feels dense or ropey rather than thin and fluid, your cilia clearance is compromised, not your mucus production. The right move is nasal irrigation, a saline rinse performed once daily, directed at the nasal passages where cilia actually live. This physically assists the clearance your cilia can no longer perform efficiently. Consistent use, not occasional, is what makes the difference. Give it 3 full weeks before judging results. Now, here's the second mechanism, and this one surprises even patients who've done their research. You have 4 pairs of paranasal sinuses, air-filled cavities in your skull, and they continuously drain through your nasal passages into a region called the nasopharynx, then down into your throat. That drainage happens all day long, and you never feel it when it's working correctly. But after 55, two things physically change the drainage path. First, the mucosal tissue lining your nasal passages begins to thin and lose elasticity, subtly shifting the angle and speed at which mucus moves. Second, low-grade chronic sinus inflammation, often too mild to feel like a true sinus infection, narrows the drainage channels further. The result is that mucus meant to travel straight down now misdirects, landing on your vocal cords and upper throat wall instead of passing through cleanly. And when mucus contacts the vocal cords, your body reads it as an irritant and triggers a secondary protective mucus response. Your throat produces more mucus in reaction to the misdirected drainage. You end up with two compounding layers of the same problem. This is not ordinary postnasal drip. The physical path of drainage has shifted with age, not just the volume of mucus. Imagine a downspout that is gradually bent inward. Water meant to flow away from the house now splashes back against the wall instead. The mistake is treating this as generic congestion. The warning signal is a persistent low tickle specifically at the level of your voice box, often triggering a dry, unproductive cough. The right move is sleeping with your head elevated at least 30 degrees, which uses gravity to restore a more favorable drainage angle while nasal tissue relaxes overnight. The third mechanism is one that most people and most non-ENT physicians never consider because the area involved is rarely examined during a standard office visit. Inside your larynx, surrounding the vocal folds, are small glands whose job is to keep the vocal cords lubricated. After 55, the vocal cord mucosa, the thin tissue covering the folds, begins to lose moisture and elasticity. The laryngeal glands detect this and respond by producing more mucus to compensate. The result is a persistent, localized sensation deep in the throat that drives the urge to clear. This isn't coming from your sinuses. It originates right at the level of your voice box, and it cycles. Clearing irritates the mucosa. The glands respond with more mucus. The urge returns. Think of it like a library book with a fraying spine. Every time you open it, the binding weakens a little further. The librarian's solution is to keep wrapping it in tape. The tape helps short term, but the wrapping gets thicker and more cumbersome with every pass. The mistake is treating this with throat sprays or lozenges aimed at the upper throat. They never reach the laryngeal glands. You're solving the wrong floor of the building. The warning signal is a clearing urge that feels deep, lower than the back of the mouth, closer to the chest, and returns within minutes of each episode. The right move tonight: do not clear your throat. Swallow firmly instead. Repeated clearing inflames the cords further and accelerates the entire cycle. Breaking that reflex is the first real intervention. The fourth mechanism is neurological, and it's the one that makes people feel like they're going slightly crazy. The vagus nerve runs through your neck and branches into both your larynx and pharynx, regulating sensation in the throat lining. After 55, vagal hypersensitivity can develop, where the threshold for triggering a mucus response drops significantly. The system becomes reactive to inputs a younger nervous system would simply ignore. Stepping from a warm room into cold air. Eating something with an unexpected texture. Talking on the phone for 30 minutes. These are not allergens. There is no immune reaction happening. It's purely the sensitivity of the signaling system itself. This is why allergy testing comes back clean and why avoiding specific foods gives inconsistent results. The trigger isn't external, it's the nerve. Picture an old house with rewired electricity where certain circuits have developed a hair trigger. The lights flicker when the washing machine runs, when someone walks heavily upstairs, when the wind shifts. Nothing is wrong with those things individually. The wiring is reading normal signals as threats. The mistake is continuing to hunt for a food culprit or allergen that explains the pattern. There is no consistent pattern because the trigger is the system's sensitivity, not the stimulus. The warning signal is mucus or clearing that arrives within seconds of environmental shifts, temperature, texture, or extended talking. The right move is gargling with warm salt water for 60 seconds before bed tonight. This temporarily calms vagal receptor activity in the throat lining and interrupts the hypersensitivity cycle long enough for tissue to settle. Now, here's what I want to be transparent about because I think it's the most important thing I'll say in this entire video. Every mechanism I've described today, the cilia that can no longer sweep efficiently, the drainage paths that shift with age, the vocal cord glands overcompensating, the vagus nerve reading ordinary life as a threat. They don't exist in isolation. There is a shared environment that accelerates all four of them, and it happens in the hours most people aren't watching. Sustained blood sugar elevation after dinner, which occurs in nearly every adult over 60, creates a low-grade systemic inflammation that is the exact condition in which every one of these mechanisms worsens. The cilia slow further. Mucosal tissue thins faster. Nerve sensitivity climbs higher. The evening window from dinner to sleep is where this either gets managed or compounds one night at a time. That is the truth I wish I could have shared with my patients earlier. What stays with me isn't the research, it's the years. The years people spent trying sprays, diets, and supplements, being told nothing was clinically wrong, while every single evening their body was quietly accumulating the inflammation driving everything they experienced. Nobody gave them a system for the evening. I wrote the 7 p.m. rule, a 21-day evening reset for adults 60 plus with stubborn blood sugar, because I wanted that to stop. Think about what it feels like to wake up already behind, foggy, throat full, body stiff before the day even starts. Think about walking out of a doctor's appointment with nothing but instructions to keep monitoring it. No structure, no timeline, no sense that anything will actually change. And think about what it feels like to finally have an evening that works with your body. Organized, deliberate, producing results you can see. Every night you wait is another evening compounding the exact inflammation driving every symptom I've described today. The biology doesn't pause. The ebook won't be up for long. We're keeping it accessible for a limited window, and that's a genuine commitment, not a tactic. Inside, you'll find the plate order fix, a specific sequencing of your evening meal that alters your glucose response without changing what you eat, and the 21-day glucose tracker. Imagine walking into your next appointment with 21 days of organized, structured data. That conversation looks completely different. The book is in the description and pinned comments. This is a referral from me to you, not a sales pitch. But before you leave, there are two things I still need you to know. The link is in the description. This is a referral from me to you, not a sales pitch. But before you leave, there are two things I still need you to know. When Rachel's scoping results came back, the finding was precise. Her mucociliary clearance had slowed significantly on both sides, and mucus was pooling at the back of her throat rather than being swept through efficiently. We built a consistent nasal irrigation protocol around her mornings and combined it with head elevation at night to address the drainage shift. Within 3 weeks, she was back at her book club. Within 6, she was calling her sister every Sunday without once stopping to apologize for her throat. The moment she described to me was a quiet Tuesday afternoon, playing piano for the first time in months without stopping mid-phrase to clear. She played an entire piece, start to finish. She told me afterwards simply, "I stopped listening to my throat and started hearing the music again." I think about that line often. Here's something I need you to hear clearly. The fact that this hasn't been resolved is not your fault, and it is not a mystery without an answer. Scoping the larynx, assessing mucociliary clearance, evaluating how the paranasal sinuses are actually draining, identifying whether the vocal cord mucosa has thinned, none of that happens in a standard 10-minute appointment. A general practitioner cannot perform these assessments in that context. The equipment isn't there, the appointment structure wasn't built for it. So what happens instead is that patients receive antihistamines, are told to monitor symptoms, and go home carrying no real framework for why the problem exists. Your body is not randomly failing. It is doing exactly what aging biology does, shifting, slowing, compensating in the ways it knows how. The system simply has not looked closely enough to see it. That gap between what you're experiencing and what anyone has explained to you is real, and it has a name. It's a referral that was never made. Consider this that referral. I'm glad you're here. Now, most of what I've described today is uncomfortable, but not dangerous. It's biology responding to age, and it does respond to the right interventions. But I want to be direct with you for a moment because part of my job, even in a video, is to make sure you know when to stop watching and start picking up the phone. If you notice that the mucus sensation or throat fullness is happening on one side only, not both sides, that asymmetry is worth having an ENT evaluate. If you feel a persistent lump sensation in your throat, not mucus moving around, but a fixed feeling that doesn't clear with swallowing and has been there for more than 2 weeks, please see a specialist. If your throat symptoms are occurring alongside ear pain on the same side, that particular combination needs clinical attention. If you have tried several interventions across multiple months and your symptoms have been consistently getting worse, not simply staying stable, that worsening trajectory tells us something important. And if any throat symptom is happening at the same time as gradual, unexplained weight loss, do not wait on that conversation. None of these scenarios require alarm. All of them require a professional who can actually look at what's there. Let me give you something concrete to leave with. I call this the CLEAR protocol. 4 steps, one for each mechanism we covered. Every one of them free and available to you starting tonight. The first step addresses the cilia. Perform a saline nasal rinse once every morning, consistently, not only when symptoms spike. The cilia in your nasal passages cannot be accelerated by will, but they can be mechanically assisted. The rinse moves what they can no longer sweep cleanly on their own. The second step addresses the sinus drainage shift. Tonight, elevate the head of your bed by at least 30 degrees, a folded pillow, a wedge, whatever is available to you. Gravity becomes a drainage partner when the structural path has changed with age. The third step addresses the vocal cord cycle. For the next 7 days, every time you feel the urge to clear your throat, swallow firmly instead. Throat clearing inflames the very tissue producing the sensation, and interrupting the reflex is itself a real intervention. The fourth step addresses vagal hypersensitivity. Before bed tonight, gargle with warm salt water for 60 seconds. This temporarily reduces receptor sensitivity at the surface of the throat lining, giving the vagal nerve a calmer environment to work from. 4 steps, no prescriptions, no cost. Start tonight. Think back to that moment at your granddaughter's school play. Sitting in the 3rd row, the gymnasium going completely quiet, and your throat filling up at exactly the wrong second. I want you to hold that moment differently now. That was not your body failing you. That was not a random embarrassment you simply had to accept and absorb. That was a signal from your cilia, from your shifting drainage path, from your laryngeal glands, from your vagus nerve, telling you something specific that no one had ever translated for you. Now you have the translation. If you want the full evening system that ties all of this together, the link is in the description. I won't keep it at this price much longer, and the people who watch this far are exactly who I built it for. Before you go, I'd genuinely like to know, of the 4 mechanisms we covered today, the cilia slowdown, the drainage shift, the vocal cord overcompensation, the vagal hypersensitivity, which one surprised you most? Drop it in the comments below. And if this gave you something your last doctor's appointment didn't, subscribe. There is more where this came from.